Time for Medical Monday. Dr. Eckardt is here from BayCare Clinic. We are talking about Brain Aneurysm Awareness Month. Let's first start off and explain what a brain aneurysm really is.
Sure, and thanks for having me tonight. So, a brain aneurysm is simply an abnormality of the blood vessel within the brain where there's a small outpouching or bulge, and that spot is relatively weak, sometimes in comparison to the normal vessel themselves, and it's prone to breaking or rupturing.
How does this happen?
So it happens sometimes based on risk factors that people have, such as if a patient smokes, if they have high blood pressure. Obviously that can cause those aneurysms to rupture. Other things that can cause it, family history. If you have a family history of brain aneurysms or brain bleeds, you're more at risk to developing an aneurysm. And then, unfortunately, some of these illicit drugs, such as cocaine, cause an incredibly high spike in blood pressure, which can cause aneurysms to rupture as well.
And that makes sense. So we want to talk now about some of the signs that are associated with it. What are some of the things you can tell in people if they might have one?
Sure. So it varies pretty highly on whether or not the person comes in with a ruptured aneurysm or an unruptured aneurysm.
I'm guessing the ruptured is more dangerous.
Correct. Correct. Ruptured aneurysms are emergencies, and they need to be treated immediately. So symptoms people typically develop are severe headache, worst headache of their life, seizure, loss of consciousness, weakness on one side of the body, compared to an unruptured aneurysm where they may just have a slight headache. They may have a difference in the size of their pupil from one side to the other, maybe some subtle weakness or no symptoms at all.
So it's hard to detect if it has not ruptured.
Exactly.
Is that why it gets so dangerous to the point of rupturing, I'm guessing, because you just don't notice?
Correct. Correct. And the majority of people that we have who present didn't know that they had an aneurysm when they ruptured, unfortunately.
So then what do you do? I mean, what's the kind of treatment that we go through?
So when I talk to patients about treatment, there's usually three options that I discuss with them. Open surgery versus endovascular therapy and observation. And it varies on the age, the size of the aneurysm, the location, and with open surgery, obviously it's a clip that goes along the base of the aneurysm. Endovascular therapy, we go through the vessel itself and coil the aneurysm off. And then some aneurysms, we take a look and there's low risk for those to rupture, and then we can follow them with serial exams and serial imaging.
I think before everybody thought a brain aneurysm you were going to die, but you can survive having an aneurysm, is that correct?
Certainly can. Certainly can, and there are long-term survivors from brain aneurysms that have ruptured, and people do have good outcomes from them.
All right, very, very good information. Thanks so much for being with us, Doc. For more info about brain aneurysms, just visit our website and click on the story. We'll be right back with today's tape.